Welcome to the Spinal Aid Decompression Workshop. If you have chronic or severe back pain, have had other opinions but are still living in pain, great news! Science may have cracked the back pain code. We're going to introduce you to a scientific discovery that is giving hope to thousands of Americans who don't know where to turn or who to trust. Hi, I'm Michelle.
And I'm Art. And this medical breakthrough in back pain is making headline news across America.
Hopeful news if you're one of the millions of Americans suffering from
back pain without drugs, needles, or surgery.
Without drugs or surgery. About 50 million people in the U.S.
There's no doubt that this is considered a scientific discovery in any medical community. But we're here to find out if it can work for those of you that are with us here today.
It is, Art, but the most important thing is to determine for those here with us who can benefit from this breakthrough procedure. Imagine, what if you could be helped by an affordable, non-invasive, non-drug scientific discovery for chronic back pain? Would you want to know more? Great, because each of you will be given the opportunity to have a free consultation with either a spinal aid physician or our web doctor online to determine if you're a candidate for this procedure so you can begin living your life without pain.
That's the best part for the folks with us, because not everyone is a candidate, and we only accept patients who are candidates and who we truly believe we can help.
Research from Duke University reports that 8 out of 10 adults will suffer back pain at some point in their lives.
Amazingly, for every 5 people, 1 person has back pain that is chronic or severe and interferes with their quality of daily living. Estimates reveal that up to 80 million Americans have chronic back pain at any given time, and back pain is also the #1 workers' comp injury, with 1 in 20 workers suffering low back injury annually. The most common back pain is due to strain sprain injuries, which arise from overexertion, strenuous movement, sudden movement, or cumulative trauma disorders.
That's right, and 1/4 of the annual health care budget is spent on pain, primarily back pain, with over $100 billion spent annually. In fact, more money is spent on low back pain than any other condition. In addition, more sick days are lost due to back pain, with over 550 million sick days lost annually. And would you believe that back pain has been reported to be among the top reasons for hospitalization, just behind emergency room visits for pregnancy?
It's true, and across America, hospital emergency rooms are filled with back pain sufferers. Each year, back pain causes Americans to spend $11.1 billion on office visits, $4.5 billion on hospitalization, $3.9 billion on prescription drugs, $4.7 billion on outpatient facilities, $1.1 billion in emergency rooms.
Back pain is the leading reason for visits to physicians, the #1 reason for visits to neurologists, the #1 reason for visits to orthopedists, and the #1 reason for visits to chiropractors. Duke University research also reports that over-the-counter remedies for back pain cost Americans $26 billion a year.
Spinal fusion is an uncertain outcome. Dr. Doug Burton, surgeon and senior spine research professor at the University of Kansas Medical Center, limits the surgical procedure himself and stated, "There is a major shift to spinal fusion procedures that use expensive mechanical devices to help fuse diseased vertebrae together." However, Dr. Burton added, "It is an uncertain outcome." He further stated that these procedures are expensive and has not resulted in significantly better outcomes. According to federal figures, hospitalization for back treatment averages over $25,000.
Alarmingly, a study published as far back as 1988 in the New England Journal of Medicine states 51% of all back surgery is unnecessary.
Nerves are among the most common reasons for surgery. And while many people undergo surgery, it's always believed better to try an alternative approach to drugs or surgery when one is available. The biggest reason believed to be responsible for the large amount of patients undergoing surgical procedures, such as discectomies, laminectomies, and fusion, may lie in the fact that not many people know about the discovery of non-surgical spinal decompression.
It's not just the public. Many physicians, when surveyed, did not know about non-surgical spinal decompression either.
According to the Healthcare Cost and Utilization Project, a national hospital database, this may also account for why the amount of spinal fusion surgery has quadrupled. The number of fusion surgeries from 1993 to 2003 has risen from over 60,000 to almost 300,000.
We want you to know your options. Only 10 million out of the 80 million back sufferers will find relief. If you're one of the 10 million with back pain of strain, sprain nature, or primarily a musculoskeletal condition, you're likely to find relief with conservative care and standard procedures. However, it is reported that 80 million Americans have back pain of a chronic or severe nature and have not found a resolve.
If you are one of the 70 million people with a chronic or severe condition, or if you've been to more than one type of physician, or have had more than one opinion but are still in pain,
if you've been told you've had to learn to live with the pain, or if you're on medications long-term or diagnosed as clinically unstable,
if you've been treated unsuccessfully, or have been scheduled for surgery, or worse, had an unsuccessful surgery that hasn't helped,
if you've been diagnosed with disc hernia, disc bulge, sciatica, stenosis, arthritis, deterioration, facet syndrome, facet arthrosis, certain levels of spondylolisthesis, or osteoporosis, there is now hope.
That's right. There's now a scientific discovery, a true medical breakthrough known as non-surgical spinal decompression.
And that's why before someone decides to accept chronic and severe pain as a way of life or undergo invasive procedures, needles, epidurals, selective nerve blocks, neuromodulation, or neuroablation techniques, discectomy, spinal fusion, laminectomy, bone graft substitutes, or artificial discs, patients are first encouraged to determine if they are a candidate for non-surgical spinal decompression.
This represents a disc as it is deteriorating, with the disc bulging at the posterior. Now we see the herniated material being drawn back into the disc as a result of decompression. We now see herniation being drawn back in and disc height increasing as it is restored. Another look from the top view shows the herniated material being drawn back in and new cells called type 4 collagen attaching themselves to the torn fibers to reconnect them and build them up stronger than before. Patients come to us for relief of pain and to enjoy their lives again, and that's what we give them.
I can drive farther. I can get out of my car without having to hold the door and help myself out and not have that pain in the leg. And I can drive farther. I feel like I'm living again. I feel like a person. My whole being is just like, I'm just real happy now. Very happy because something finally worked.
Professional team members apply their individual skills and knowledge to make an accurate diagnosis and prescribe the right individual treatment for those who may need the procedure. This painless and non-surgical alternative approach is certainly worth trying for those who are in pain, have had multiple options only to remain in pain, are on medications, scheduled for surgery, or worse, have had surgery and it did not work.
It's a breakthrough. Anyone who has a chronic or severe back condition and/or has been diagnosed with disc bulge, disc hernia, true sciatica, stenosis, facet arthrosis, or deterioration is encouraged to seek a consultation to determine if they are a candidate for this procedure. Well, that wasn't so hard, was it?
No, not at all, Michelle. In fact, for those of you who answered yes to an affordable way to get the help you need and are interested in finding out how to get started, we've made it simple. All you have to do is to schedule a no-cost consultation with the doctor before you leave.
We want to make it easy, and we're happy to assist you to take the first step and schedule your appointment for one of the next available consultations at no cost. Fair enough?
Sounds fair to me. The doctor has set aside time during the remainder of this week, and as you schedule your appointment, you'll be given a DVD to view so you know what to expect before you come in. Thank you for viewing this presentation, and we look forward to scheduling you for your no-cost consultation with the doctor at this time. Here at Spinal Aid, we're committed to helping people get out of pain and get their lives back.
Thanks for watching.